Thank you so much, Shireen, for the very warm welcome. It's really such a delight to reconnect with Gendra, which has been such a wonderful support to so many researchers in addressing gender inequalities in health. And now we're moving into a much more digital phase of that effort. So really look forward to thinking with all of you today. So I'm joined today, as you mentioned, by James Kilu, who's a representative of the Kenya Community Advisory Team of the Digital Health and Rights Project. And James also joined in a recent workshop where we shared this report with WHO, with the Digital Health Department, and just blew everybody away with his brilliant insights. So really great that James can be here, as well as I think one or two other members of the Community Advisory Team in Kenya. So the plan is that I'm going to do like rapid fire, New Yorker, high speed overview of our study, which is not yet published. So this is kind of an advanced preview. So I'll do that for about 15 minutes and then pass the floor to James for his intervention. And then we'll open up the floor to discussion and look forward to that, which I'm sure will be very rich. Just to explain how we came to be working together. So the Digital Health and Rights Project Consortium is, as you can see, a large international consortium of academics like myself, social scientists, human rights lawyers, civil society activists working on youth leadership, digital rights, HIV and human rights, and community-led networks of people living with HIV, both a global network and two national networks in Ghana and Vietnam. And we've come together as a consortium to conduct participatory action research in Colombia, Ghana, Kenya, and Vietnam to investigate how the digital transformation is affecting the human rights of young adults who are either living with HIV or most at risk of HIV, including key populations, and what they see as both the benefits and the risks of the digital transformation in health, engaging them both in designing the study and in developing advocacy based on the findings. And so that's how we came to have a community advisory team in Kenya, as well as in the other countries where we're working, that includes young adults who participated in previous research or who are leaders in civil society working on health, human rights issues. So bringing together these different groups of individuals to advise on the research, and then using the research findings lead on advocacy, both nationally and globally. So that's how we came to be working together. And it's really been a privilege and a delight to work with such inspiring young people from these four countries who have so much richness to bring to this discussion. The project that I'm going to share with you today is a little bit of a spin-off from that larger endeavor. So we'd love to come back to you and talk about the findings from our big four-country study next year when we finally have them. But for now, this is a little bit of a kind of an opportunistic response to a need that was identified in our discussions with the World Health Organization. So I'll tell you a little bit about the aims and background of that study, about our methods, and then sort of our preliminary findings, as well as some recommendations that we shared with WHO colleagues a few weeks ago. So briefly, this came out of a discussion we were having with the Digital Health Department when they shared that they had put together this compendium of national digital health strategies. As part of the Global Digital Health Strategy, WHO has been working with member states to either develop new digital health strategies for the countries or update the ones that they have in place. And so my question as a longtime human rights activist was, so how are you addressing gender and human rights in these strategies? And the response was, well, actually, that's a good question. We're not sure that we are, but maybe what you could do is look at a subset of these strategies and identify some gaps, and then we'll use that to develop normative guidance that could support countries to consider these issues in their strategizing. And so this was how we came up with this collaborative approach, and we got some funding from University of Warwick, as well as from our existing funder, Fondation Botnar, Swiss private foundation, just as a small intervention to develop this kind of rapid review. And one of the reasons we did this is, and I'm sure it's not news to anyone on this call, there are a number of inequalities, including gender inequalities, that are shaping access to digital technologies, uptake, design of those tools, and how effective they are at linking people to health information and health services. And these include digital divides, so unequal access in terms of the ability to pay for smartphones and airtime in many countries. So for many people, the smartphone is the main portal for accessing health information and services. But if you can't afford one, or if you don't have Wi-Fi or airtime, your access is limited. And these divides extend to gendered inequalities in terms of access to education and socioeconomic resources, linguistic differences for different groups. I mean, one of the countries we work in is Ghana, which has over 90 languages. So you can imagine that that creates challenges for people who do not speak any of the official languages. Issues with privacy and surveillance and targeting, issues with online abuse, algorithmic biases and discrimination, growing evidence of very complex mental health harms, and then just the ways in which these technologies are becoming increasingly determinants and are themselves also shaped by other underlying social, political, and commercial determinants. They can shape what's prioritized, what is piloted, what is brought to scale, how data is gathered, and who gets access to that data. So there's a number of considerations to think about in strategizing, and two of our publications here have documented some of them. So happy to share those links for those who are interested. So we developed a draft assessment tool, which we did by reviewing existing tools for assessing gender and human rights and other areas of WHO's work, as well as other UN normative guidance on assessing gender equality and inclusion. So we developed a list of questions, and then we worked with WHO's digital health department, as well as with regional focal points, to identify a set of 20 countries. No list of countries is ever going to be representative, right? It's the idea of having countries represent other countries is fundamentally a problem. I think actually, even though we do it all the time in global health. But anyway, we tried to come up with a mix based on different geographic regions, country income classification, population size, digital development, et cetera. And then, of course, we included the 4 countries where we have these wonderful community advisory teams, because we thought that's a great way to bring their perspective into the discussion and also equip them with something that they can use in advocacy going forward. So these are a list of the countries. Happy to explain or defend our choice, which may seem bizarre to some, but anyway, as I've said, I think any selection of countries is problematic. And also, I think we really saw this as a sort of a first pass at looking at a question that clearly deserves much more study and discussion. So hopefully this is just a kind of indicative review. So with those caveats in place, I would say our initial findings were that there were some strengths of the 20 digital health strategies we looked at. We did see privacy addressed frequently as a top concern, which is appropriate for digital health. Data security and confidentiality were often highlighted, so that's great. We saw that many digital health strategies were really bringing together health officials and IT officials to kind of come together, sometimes for the first time, to really talk together about the existing regulatory frameworks and what the gaps might be. We saw in some cases really excellent and detailed implementation plans, including indicators and monitoring frameworks. And it was clear that digital health strategies that are developed by member states are sometimes the first way to create a platform for people to come together and start talking about these issues at the national level. And we know that's really, the importance of that can't be understated, that sometimes these strategies are political tools that are really essential to create that space for broader coordination and discussion. However, we did find some challenges. And one of the reasons why we're here, I think, is that we found almost no reference to gender in the strategies. Literally, I mean, if we did a search for the word women, we got nothing. If we did a search for the word gender, almost nothing. So there was really very little kind of consideration of the fact that in many countries, not all countries, but in many, there are digital divides that are shaped by gender inequalities, and also that there might at national levels be a Ministry of Gender, a Ministry of Women and Youth that has a strategy that includes digitization and that should be in the consideration as part of a digital health strategy. So I think there's a missed opportunity there for collaboration. We saw that the visions and principles and objectives tended to lack reference to rights and equity, and that most of the strategies didn't really consider the fact that there are very many diverse populations who might have different kinds of access and needs. One of the exceptions, interestingly, was China, which did a quite comprehensive kind of consideration of the needs of national minorities, of older people, persons with disabilities. I think any of us who are helping our elder relatives to access the internet know that older people really face challenges with accessing health information and services in the digital age. So there is a need to think about the kinds of support and needs that they might have. And then again, yeah, just this missed opportunity to collaborate, very little civil society participation. I think Ghana was the one country where we saw a youth representative, one youth representative, and we know her and she's fantastic, but I think there's again a missed chance to really use these strategies to bring together diverse stakeholders who can really collaborate on digital health. And then there are broader challenges. So we didn't see much discussion of artificial intelligence, which is not surprising considering how AI has just risen to dominance in the past few years. But that is an issue that will clearly need to be addressed. Not much talk about things like neurotechnology and other new and emerging technologies that create benefits, but also challenges. And then not much consideration of digital health literacy in the broader public. So a little bit in some strategies of consideration of healthcare workers, and that healthcare workers might need training and technical support in order to be able to support the digital transformation, but really no consideration of the needs of end users, of people in the community who now need to access test results and book appointments and do telemedicine and navigate health misinformation and disinformation, and every person who thinks that they're an expert on YouTube. So how does everyone navigate that? I think this is a huge gap that really needs to be considered. So, oh, now suddenly my computer is not clicking. Let me see. There we go. There is some excellent guidance, so we just want to flag that good guidance has been developed and published, but that it isn't widely known and hasn't been widely shared. So these are a few of the ones we've come across, but there are many others, including from WHO, and they seem to have stayed at the level of kind of global health, but not gotten to national digital health strategy planning. So finally, our recommendations, number one is for WHO to start integrating some of this analysis into their normative guidance, briefing materials, training for countries on developing digital health strategies. It's not clear how or when this would happen, but I think it's really crucial that it start to happen immediately because having no gender in any of the digital health strategies is clearly an urgent gap. And then developing assessment tools and partnerships that can start to support this. I think there's a real need for more evidence and more examples of good practices around gender and inclusion in digital health that addresses these inequalities. And that also means that funders really need to change their approach. We have a lot of pilots, a little pilot here, a little toolkit there, but not really kind of a comprehensive strategy for funder agencies, whether they're philanthropies or bilateral aid, to really think about how they're going to scale up work to address inequalities in digital health, including digital health literacy, which we see is really, really crucial that this be massively scaled up to address all the different needs that people have. And then facilitating spaces for more inclusive and participatory discussions is really crucial, and obviously something we're very deeply invested in as a consortium, that we really have youth participation and engagement at every level. So that's my rapid fire overview. Sorry for being a fast talking New Yorker, but I wanted to allow ample time for James. This is our contact information. We're going to do a webinar to share the findings and launch the report probably in December. So this is a little bit of a sneak preview, but happy to unofficially share the report with those who are interested. So with that, I'm going to pass over to James and then look forward to your questions and reactions. Thank you.
Thank you very much, Meg, and also to the organizers for the opportunity to share with you today. I'm very happy to be part of this conversation today. So I just say that from the onset that the findings from that report reflect the realities in most of our countries, where the issues of equity, the issues of inclusion are usually not given the due weight that they deserve. And so my comments are integration of what I shared in Geneva and also from the comments of my colleagues from Colombia, Ghana, and Vietnam. So one thing we noted is that, as always, the policy directions which is being taken by most government is what would be classically defined as one size fits all. That they identify the problems that the health systems is facing, and then they don't give the weights to differential experience of different populations in the community and the country, which lead to different health outcomes and most of the time poor outcomes in certain populations. So when it comes specifically to digital health, for example, in Kenya, we've been talking to some key populations in the past months, and they shared with us some challenges that they face while trying to access health services and share health information using digital platforms. They were raising issues such as confidentiality, that their privacy might be breached, the issues of being not able to afford data, even to access the basic internet services. They were talking about being stigmatized, even in digital platforms that they try to access these services. And it's true that these these bad experiences are more common in certain populations. You find more common in gay people, in men who have sex with men, in female sex workers, and even in women. For example, in Kenya, there's such a large gender gap in mobile internet usage of about 34%, a very large gap in smartphone ownership. And these issues are driven by affordability, low literacy, and also access to the national power grid. Same in Colombia, my colleague Desiree gave a story about how cisgender women living with HIV usually face the stigma and are left to rely on unverified health information online, while transgender women, particularly sex workers, also lack internet access and safe digital spaces, amplifying their exclusion. So even if they're able to access the digital health platforms, the internet services, they fear that they might be tracked. So they have to go to certain sites which do not promise to give them the information that they need. Same way in Vietnam, Tu shared a story about how women, particularly from the rural populations and marginalized ethnic groups, also lack internet access, and they have low digital literacy, and this has been hindering their effective digital health engagement. And so it's important that going forward, we need to integrate these digital rights and literacy into a system that they become accessible to every youth, to every person in the society, so that as to protect them as they access health services online. Also, we had a colleague in Ghana who also shared the Ghanaian situation, that many young people there feel that their digital health needs are unmet. They also expressed concerns about the inadequate privacy protections and lack of meaningful representation in digital health policy discussions. The same thing also we see in Kenya, where when we're talking to this key population, they say that it appears that we not only don't understand their issues, but also we are very deliberate in ensuring that we don't understand the issues they face as they try to access health services. And they say this is reflected in the policies that we make, the limited consultations. They ask, who are the people are you consulting as you make these policies? Who are the people are you consulting when you come with just blanket statements about access to health services, where everything is just equitable access, while not giving due weight to specific populations who are adversely affected as we speak. We are not talking about the people living with HIV. How are we going to address the issues which more affect people living with HIV, women, same as gay populations? So when we talk about equity and equitable access, it's more of it has become academic to the people who face these issues, because we say yes, we need equity, we need equitable access, and that is reflected in every policy that we have. You will not lack the word equity or equitable access, but does not go into length to define what that is. What does equity or equitable access mean to a gay person in Kenya? Or from the onset, they are not able to love whoever they want to love openly. What does it mean to a person living with HIV, whom you are forcing them to register into the digital health platforms without really addressing the key issues which face them, the stigma which they face? Yes, so those are some of the issues which we highlighted. And also, when it comes to access to digital services, the discussions of equity also need to be advanced across all discussion that we have across the healthcare system, so that we need to have the discussions happening on all platforms. We talk about equity in research, equity in healthcare, equity in education, because the issues of equity are not just limited to health and are not just limited to the digital health platforms. These are discussions that we need to have it across all boards and with the different partners in the healthcare system. And that also needs to have a model of meaningful youth participation that incorporates youth consultations and ensure a structured, impactful role for young people in decision making. My colleague from Ghana made a very interesting comment that youth participation, meaningful participation, is not like a one-day event where you call young people in a meeting, then have like 6 hours with them, then ask their views about different issues. This is a continuous process that need to be matured over the years. So also, it was a recommendation that in the coming times, we need to develop indicators of what would be defined as meaningful youth engagement. Also, because that is another term which is also academic when it comes to the ground. Most of us would find a problem in defining what is meaningful youth engagement. When would a young person say that, yes, I have talked, and I think that what I've said has been given due consideration? The same thing also for when we come now for key populations, we also need to find a way to meaningfully engage criminalized groups. When you come to Kenya, you find like gay people, there are legal ambiguities about their rights, about how they exercise their rights, also female sex workers. But these are people we need to ensure they fully participate in the global health practice. So how, with the criminalized status, how do we ensure that their voices is also heard? And also, that is another issue that we think we need to address in the coming years. Another thing is we also, we also talked about supporting young people to advance the digital literacy agenda, digital empowerment, and also address digital divide through collaborations. For example, when you look at it, also digital access is also, when you even go into the key population themselves, you find that there are many factors which interact to disadvantage some groups. For example, when you come to, for example, men who have sex with men, you'll find most of them, their digital literacy is a bit better than maybe for female sex workers. And that was reported by one of the papers which Meg's published some years ago. The same thing, we need to look at these specific groups as we try to tackle the digital device that we have. Every group has its own challenges and dynamics. So the same way, we cannot have one solution for every person. We need many solutions for many diversities that we have. The other thing is that going forward, it was emphasized that it is the function of an health system to create equity. And from the onset, we should have health systems which are deliberately structured in a manner that promotes equity. And that starts even from the community, from how they access health services, even going forward to the policies. And that is something which we see is not being reflected in most of our populations. And the issues of health equity are not just limited to low and middle income countries. There was a report also presented during the workshop, which showed that even in high income countries in Europe, women, young girls, adolescent girls, gay population, men who have sex with men, also face the same issues that those populations face in low and middle income countries. And so it's a global, it requires a global effort, it requires global solidarity in addressing these issues. And that's where we need to move the discussions even to the funders. What programs do they fund? Do this program promote equity? Do they promote a situation where all people can fully exercise their rights of citizenship? Yes, so as I come to an end, we also need to promote youth-centric approach and also address the health system as a whole. And that means that we cannot just focus on digital health without also tackling the other systemic inequalities that you have in the health system. And a case in point is that also, I'll quote another report that Meg published some years ago. In Ghana, there's reported that some people, some HIV, people living with HIV were feeling stigmatized as they were going to seek services in the health centers there. And the response that was there was that they will fail to get the consultation that they needed to get with their clinicians and then go and seek services from the online platforms. And most of the time was that they will not get the correct information. They will start getting medications without going through the due process. And that does more harm than more good. So the same way, we cannot just look at digital health in isolation. We also need to look at the health system as a whole. There are many systemic inequalities, and as well, the digital health inequalities also stem from other inequalities in the society, inequalities in education, inequalities on how we understand the different issues that face different populations. Yeah, so that's also a very big thing that we need to address all the issues in the health system as a whole.
Thank you.
So,
oh, sorry. I just conscious we've gone a little bit over time, and we do want to allow some time for Q&A. So do you want to maybe just make your last point? Thanks.
yes, I've just completed maybe in the next 30 seconds. Yes, so in summary, yes, so we need to just address the other determinants of health and also support young people to tackle these challenges through digital literacy in multiple dialects, also mentoring for meaningful engagement. Yes, and yeah, ensure that young people are fully engaged. Thank you.
Awesome. Thank you so much. Back to you, Shireen.
Great. Thank you so very much, both Meg and James. I will stop recording now.